We're going to do a medial unicompartmental knee using the Journey 2 unicompartmental knee and CORI. So start with exposure, just like we do a typical exposure for a partial knee replacement. I palpate the tibial tubercle. I usually mark above the tibial tubercle, the inferior pole of the patella and the superior pole of the patella. And then I make my incision the same as I would for a total knee. I don't go further medial. I just make it a little shorter. I just stop at the top of the patella. Exposure, just like you're doing any other partial knee replacement, start at the top of the tibia. I go down to the extensor mechanism, expose to the top of the patella. Okay, so I do a medial arthrotomy, so just up at the top of the patella, medial arthrotomy, but you can do this obviously however you want. People who are just starting doing partial knee replacements should probably make a bigger exposure, at least initially. And you can either do a parapatellar approach. I do a little mid-vastus approach for my partial knee replacements. So exposure for the medial compartment of the knee, and then I'm going to get a Coker retractor. We're going to take out the medial meniscus so we can see the medial part of the knee. But your exposure, really, you don't want to do a big medial exposure, but you do want to be able to see around the medial side of the knee. So you need to do enough of a release around the medial side of the knee for exposure, but not any real ligament releases. Take out as much of the medial meniscus as I can. Some fat pad here. So here's our exposure to the medial side of the knee. And that's really about all I typically do. We'll get this a little deeper. Okay, so I'm looking at the knee, and I'll check the patellofemoral compartment. I'll check the lateral compartment at this point, and then we're going to start our registration. You want to be at least 1 hand's breadth below the tibial plateau, just so you're out of the way. Okay, and then we're going to put 2 pins in the tibia, about 2 centimeters apart. We've got these speed pins that are 3.2 millimeters. They're drill tip on the end, 3.2 millimeter pins, so they're really pretty narrow pins. They drill through the cortex pretty easily. So we have 1 pin in, and then I typically use the guide itself. So I put this in, and I've made my incision already. I put my 2nd pin in. Grab that. No, just take that. Okay, and then I want this close to the tibia so that it's more rigid. And we've got our tibial array that snaps in. And you can tighten these with your thumbs. There's also a tightener. And then we go up to the femur. And there are a couple of places you can put your pins in the femur. I tend to put them just in the medial femoral condyle here. I'll just take a knife for a second. So I don't have to go through the quad. So I just come over the medial side, 2 poke incisions. First pin into the medial femoral condyle. Pin comes off, so don't drop that. 2nd pin goes through the guide so you know your spacing. Down onto bone. And your 2nd pin goes in. And your array again snaps into that. And at this point you want to check and make sure, once you've got these tightened, that your camera for your system, I'll just take that to tighten, can see both of your arrays so that you don't have to move later. So if we're looking on the computer screen, and I've got the tablet in front of myself here, so I can see everything on the tablet here. It's a touch screen. We've also got the camera over there. If you're looking in the center of the box on the screen, we're looking for femur and tibia. So tibia is a triangle, the femur is the square. In full extension, we can see both of them. Up in deep flexion, we can see both of them. So I'm happy with the position of the arrays. The other thing that I check at this point with my pointer is to make sure it's going to be in view, because I don't like having to move the camera around in the middle of the case. I just want to make sure I'm going to be able to get the pointer. It can see when I'm working on the malleoli, and it can see when I come up here as well. So all of those are within view. So I'm happy with the position of those now. Next thing I'm going to do is put my checkpoints in. And we've got this checkpoint holder. It's actually magnetic, so it grabs the checkpoints, and they're easy to put in. You can either push them in by hand or mallet them in, and then you can just go grab another one. It just pulls the 2nd one out magnetically. So you want to put this in the femur. You want it somewhere that you can get to easily, but isn't in your way. So next we're going to move on to our registration. So I've got a foot pedal down here that I can use. I've also got a touchscreen tablet up top. Okay, so I'm going to take my checkpoint on my femur first, and then my checkpoint on my tibia. And then we're going to start a real registration. So we've got to register the center of the ankle. So there's the medial malleoli. There's the lateral malleoli. Next, we register the center of the femoral head. So I hold the leg in my hand, slightly flexed, slightly abducted like this. Put my foot on the foot pedal, and I just make a slow circle, and I'm just trying to fill all of these quadrants, or I guess not quadrants, but all of these segments until they're green. Next step, holding the leg out in full extension, I actually load the leg, so it's like a standing view of the leg, and collect. And then we collect through an arc of motion. And again, each of these pieces of the pie, you want to turn them green so that it's got initial range of motion of the leg. Next thing we're going to do is our stressed position of the leg. So I actually hold the pedal down. I grab the leg, and I put a valgus stress on the leg. And then I bring the leg through a range of motion. This is a little difficult. The way I do it is I actually put my chest up against the outer part of the knee, hold the thigh here, and I'm stressing it through that arc of motion like that, pinned to my chest. The other way that you can do it, that some people do, is actually put a retractor like a Z retractor in the knee and put it in that medial joint and collect points like that. Now you can actually have somebody help you. So if you just unlock this here, I'm holding this, I'm putting stress on it, and just bring the leg out into extension. You can go through that arc of motion and collect there. Okay? So that's our stressed point collection. That's for correction of any varus deformity that we have and ligament balancing. So we'll go to the next step. And now we're going to do our actual registration of points on the femur and the tibia. So the first point that you want is your tide mark point. The way I do that is I bring the knee out into extension. I see where the front of the tibia engages the anterior portion of the femur. Okay. So then we want the center of the knee. And this is for mechanical axis of the leg. It needs a center point of the femur. Okay, then you want your most distal point on the femur. I find that the easiest way to do this is put the leg at about 90 degrees. And then I look in line with the femur. And I put the probe on the femur. And I want to be about middle of the femoral condyle when I do that. And then my posterior point, again with the knee at 90 degrees, I look at where the posterior femur engages with the tibia. So the next thing we're going to do is our free point collection, which is basically painting the femur to get a three-dimensional representation. So it really is just painting. So I try to make an outline first, and then I fill in. And you can see the anatomy that's showing up as we collect all of those points. Okay, you really want to get along the medial femoral condyle, along the medial epicondyle or the medial epicondylar area. And I can actually take this and I can rotate so I can see what I'm looking at as well. I want to get a little further posterior, so I'm just going to flex the knee up further to get further to the back of the knee. Okay. Now it's calculating. As soon as you see the orange come up here, you can move on to the tibia. So same thing on the tibia. ACL footprint first. Then the depth of the medial tibial plateau. This point is a difficult point to get. You want to get as far back on the tibia as you can get. It's for sizing and orientation. Then you want to get the anterior tibia. And then you want to get the medial tibia. What's important here is that if you have osteophytes on the medial side, you want to get rid of those osteophytes first because it's sizing off of this. So you want to get rid of any osteophytes along the medial plateau first. Your intercondylar eminence ridge, which the way I get this is I just slide right down the medial femoral condyle and collect that point or that line. And then you want to paint the tibia, same thing as you did on the femur. And you want to get back as far as you can, but you don't have to get all the way back on the tibia. You want to get the front of the tibia, you want to get all the way to the tibial spines. And what I do at this point is I actually bring the leg out straighter so that I can get the anterior portion of the tibia, and so I can get around the medial side a little further as well. Okay. So that's our registration. The next thing we're going to do is our planning. So I'm going to continue here. And now on the screen, you're going to see your femoral implant and your femur first. So the first thing I do is I go to cross-section on here, and I look at this upper right image. And what I want to do is I want to make that image match what my geometry of my femoral condyle is. So it's actually matched it pretty well here. I'm just looking at that arc right there, and it matches pretty well. So I'm going to leave it there for now. On the tibia, I want to move right to the front, so you can see we're a little posterior on the tibia here. So I'm going to move the tibial implant a little anterior, and I'm going to move it closer to my eminence ridge here. So I'm going to move a little lateral, and then I'm going to slide through this one here and make sure that right at the front, so my tibial implant matches that anterior cortical rim at the front of the tibia. The other thing that I do is I always plan for a 9mm poly. That just gives me the ability to go up or down by a millimeter if I need to. And now we're looking at our ligament balancing. And you can see this orange graph here, which is where we're going to be. So this says that the alignment of this knee, this patient started in 4 degrees of varus, and if we put things in like we've planned right now, we're going to end up at 0. Now, typically with a uni, you want to either remain in a little bit of varus or correct to neutral. You don't want to go over into valgus mechanical alignment. And you can see here, because we're below the line, we're a little bit tight everywhere. So if we're a little tight everywhere, we can change that with the tibia. So if I go to the tibia and I resect a little more tibia, another millimeter of tibia, all of a sudden we're at or above that line, and then we're going to end up in 1 degree of varus mechanical axis alignment, which I think is great. You'll see this very often with partial knee replacements, and it's fine with partial knee replacement, is this graph is straight, and then as you get into deeper flexion, you actually get a little looser. And we want the uni to be a little looser in flexion, so that's okay. What you don't want to see is in the 60 to 80 range that it actually gets tighter. You'll actually feel that as you take the knee through range of motion. If we want to flatten this out a bit, we can go back to the femur, and we can move the femur a little more posterior. And you can see as I move the femur a little more posterior, it's tightening up flexion, but it also tightens up this mid-flexion zone here. So if I want to do that, I'm going to have to take a little more distal femur as well. Still a little tight there. I don't really want to see it tight there. So I'm going to move this back a little bit. And I'm pretty happy with this graph where we're kind of 0 to maybe a millimeter loose in extension. And then as we get up into flexion, the knee gets a little looser. That's pretty normal for a partial knee replacement. Last thing that we're going to do here is we're going to check our tracking. So if you look up here, you can see the contact points through that arc of motion. Each of those dots represents the position through the arc of motion and where your tracking and contact is going to be. So this actually looks excellent. We're tracking right up the center of the femoral implant. And if you look at the tibia, we're central on the tibial plateau for our tracking. So I'm happy with my sizing. I'm happy with the tracking through an arc of motion. So I think we're good to go. We're going to move on to our burring now. So here we have to just check our checkpoints again just to make sure nothing has moved before we start burring. Okay, and then we're going to start burring with our femur. So you just have to go into a couple of different positions just so you've got good exposure here. And this is the new Smith+Nephew CORI burr. So it's made by Smith+Nephew. The older burr used an Onspach burr. This is a Smith+Nephew device. It's one piece, easy to put together, much faster and easier to use, much more ergonomic in terms of hand control. the array can rotate back and forth so you can get good visualization. And we're going to move on to cutting the femur. I'm going to hook up suction there. It's got suction and irrigation built right into the handpiece. Get the suction turned on there. Okay, and all I'm doing at this point, I'm pushing the pedal, and you can see right now there's no burr exposed. As I get to where I want to burr, that burr tip, and I don't know if you can see it from there, but that burr tip comes out to basically go and get the bone where it needs to get the bone. So I'm burring away here, and I'm just slowly moving back and forth, and it's going to the appropriate depth to remove the bone. Okay, that's good. So I can get this superior portion up here. So this is the distal portion of the implant. You can see where the peg hole is going to go, right there. And let's just move you over this way. Good, right there, perfect. Just holding that soft tissue out of the way while I get this stuff on the medial side. And I typically do this in about 3 positions. So I start with the knee a little further extended so I can get, let's get that retractor there. See if you can just reach, yeah, perfect. And here this is getting the area of the chamfer. You can see the second, where the second peg hole is going to be. And with the new Journey 2 Uni Knee, we have a couple of options. We can burr our peg holes now. We can also put a trial implant on. And once we're happy with the trial, it's actually got a drill through option, so you can drill right through it. Okay, so now once I've gotten there, now I'm going to go up into full flexion. And this burr tip actually extends 12 millimeters. So as long as I'm in the right plane, it's essentially just going to go and get the bone. And you can see it's doing that right now. It's just extending. If you look on the top right of the computer screen, you can see what the burr is doing. Okay, so if you look here, you can see what the burr tip is doing. So you can see how it's extending to get the bone, or it's retracting in when it doesn't need to. I can take this and I can rotate this around so I can see what I'm trying to, the bone that I'm trying to remove. And I can actually even on the screen put the implant in, so you can see it actually burrs wider. It burrs that whole condyle. So I'm not really worried about this green that's over on the side here, because I know it's not where my implant's sitting. And that's a very smooth surface with the new burr. It's much smoother than what we had. Okay, so that's the distal cut, the chamfer cut, and if I flex the knee up further, you'll see the posterior condyle. So the peg holes, I'm actually going to give myself a little targeting system here. The green is the tip of my burr, and the blue is my handle. So I'm lining myself up, and it's targeting. Right, so there's the tip. When you get those 2 circles lined up, that burr tip will go now. Okay, you can see my burr is fully extended there. So that's one. And again, if we get lined up here, okay, that's the other peg hole, and now we're going to go to the tibia. So I'll just show you speed mode to start with. So it's the same thing. Right now, nothing's happening because I'm not where I'm supposed to be burring, despite the fact that I've got my foot on the pedal. And now as I get into plane with where I want to burr, all of a sudden that burr starts. So if you want to use speed mode, you just have to stay in bone that's going to be resected. So as long as I stay above the white, that burr will keep going. Okay, so a couple of different methods. I can tunnel back and forth like this. Okay, and that'll keep going, and that's eating away bone pretty aggressively. And then in a second I'll put that sleeve back on and you'll see what it's like doing this in exposure mode instead of speed mode. So as long as I stay above the white, this burr keeps going. But if I try to be too aggressive with it, the burr just stops. So it's controlling the speed of the burr, not the exposure of the burr. Okay, so you can see I've been tunneling underneath everything, so we can see into the knee. Let's go back into exposure mode. So we put this sleeve back on, and let's hook up our suction again. And now I can move a little faster because that burr is only going to the appropriate depth. I know it's not going to do anything more than what it's supposed to. Yeah, thanks. Okay, so I can kind of sweep back and forth over top of this. And again, it kind of goes just to the right depth in order to get the bone that needs to be resected. And right now, as I'm working on this inner wall here, I'm looking at that picture on the bottom left. But the image, the big image in the center, you can actually spin it into whatever position you want. So whatever you want to be looking at, you can spin it into that position. And the stuff that's on the top, that's actually just floating bone. That's not real bone. So you're fine there. Okay. So now we're just completing our partial knee replacement. So we've got to make sure that we get rid of the remaining meniscus. We've got to look for osteophytes. It's a rectangular rasp that's really nice if there's any little bits of bone that are left. It's a really nice rasp. It also gets the wall along the ACL footprint. Okay, so we're good there. Next thing that I do is I'm going to size the tibia. So a little hook on the back here. So you can see this is the actual size of the implant. So you can go over the back of the tibia, hook this in the back, and then I look to see where I am in the front. And we've got the ML size as well. The Journey Uni knee was actually predicated on the Zook Uni, which has had a great implant, great track record. And what we tried to do was increase the number of sizes, make the anatomy a little bit better, and then make better instruments and better materials. So there are more sizes here than with the Zook, but a lot of the things that you'll see look pretty similar. So that fits really well on the front of the tibia. It's hooked in the back of the tibia. This is to punch the keel. So there's a little pinhole up front here. You can put a pin in, and there's a keel punch here. We just got to make sure that we don't let that move as we're punching for the keel. Yeah, a little more, a little more, a little more. Great. Okay, that comes out, and we're going to drill our lug holes for the tibia as well. This is easiest in deep flexion, so you can get past the femur. And again, you'll see these look similar in position to where the Zook tibial pegs were. And these engineers did a lot of work looking at pull-out strength and position of these lug holes. And let's get it back here so I can get, there we go. I used this that has the hook in the back. There's also this one that's got a little nubbin on the front, and there's a handle, but you can actually grab it and hold this tibia in, and you can drill through that as well. So we'll put this in. Do you have an impactor? Okay, so we're just going to hit this down. We've already drilled our holes. The other point I was going to make is any femoral size will fit with any tibial size, so they're independently sized. Okay, an impactor, and we have a mallet. Here, yeah, you want to hit that. And then good. And then we set this up for a 9 poly trial. So, okay, so we'll put our 9. So in deep flexion, remember we were loose in deep flexion, which a uni usually is. So it should be pretty easy. This is for 7, 8, yeah, okay, 7, 8, 9, good. So let's make sure we get this in. Good. And then we can bring this out into extension. And we're going to collect our range of motion again here. Okay. Just get around the medial side here. Slide that in properly. You know, can I get an 8mm poly? I think I'm going to go one looser. Great, come on out. And there we go. Okay, that's better. All right. So if we bring the leg out into extension now, on the screen there, we're at 2 degrees of flexion. If I push it, I get to 0 flexion. And we're 1 degree of varus, which is exactly what we planned initially. And if I want to, I can take this through a range of motion again here. And I can stress it through that range of motion if I want to. And we can see our laxity in the knee when I do that. And you can see we're pretty good. Okay, so as we get up into deeper flexion, and it's impossible to put a valgus stress with a cadaver that doesn't have the rest of their body up here as we get up into deeper flexion. But that's it. So then as we look at this, the other thing I just want to show everybody is how this is tracking through an arc of motion, which is just what we planned. So if we look at the black line on the front of the tibia, and we look at the black line on the front of the femur, in flexion, those two are perfectly lined up. And as we track out into extension, those are still lined up. I don't think you can see that, but when you look into the knee, you can see that up through that arc of motion, we've got excellent tracking through that arc of motion. So we can see it on the screen, but you can also see it when you just look in at the knee.